All right. So let's talk about diastasis recti. That's a really hot topic. Everyone's, talking about it now. And I think it's really important. So like I said, right, as the baby is growing and everybody and all the muscles are stretching outward, right? Diastasis recti in specific refers to the stretching, thinning, and the weakening of this linea alba, which is, if you see the center of the abdomen here, it's this white, long connective tissue that starts from our sternum and goes all the way down to our pelvic bone in the front. And our rectus abdominis muscles, which are the muscles that are surrounding the linea alba. It's your first layer of abdominal muscles that you notice if you touch your stomach. Okay, also responsible for the six-pack look. All right. Now, in reality, right, it's not just the front of your muscles that are getting stretched out. It's all the muscles surrounding your stomach that are getting stretched out. So I really like this visual because you can see this is a picture of somebody pre-pregnancy, and then this is what happens during pregnancy. And you can see it's not just in the front, but the side muscles. So the muscles that we call our internal and external obliques and our intercostal muscles, all of those muscles also get stretched out. So it's, we often talk, when they talk about diastasis recti, they're talking about the gap and the width of the gap and the depth of the gap. But it's not only about the gap, it's about all those other muscles that are surrounding your abdomen as well. All right, next slide. Okay, so again, this is a visual that shows how there are different variations of diastasis recti, right? So the separation can happen anywhere along the linea alba or along the full length of the linea alba. And really, treatment-wise, it can vary depending on where that separation is, but also a lot of the treatment is similar. And another really important statistic to remember is that 66 to 100% of women have this diastasis recti by the end of the third trimester. It's considered normal, right? There's nothing wrong. You've not done anything wrong if you end up having diastasis recti, because it's your body accommodating for that stretch for the baby growing. It's a very natural process that happens. And a lot of times after the baby is born, that diastasis recti starts to, so it won't be maybe as, that gap and that widening won't be as wide as it was when the baby was inside. You might still have it, right? We've still had that stretching, but once the baby is out, the stomach kind of starts to come in a little bit more, and you might notice that it's not as big or wide as it was during pregnancy. And there's a lot of mixed evidence in terms of DRA. So we know that it can happen, right? And it can cause issues within that pressure system that I spoke about. But the size of the separation is not always indicative of the person's function or their strength. Okay, so an example is like if you have two women who are postpartum, and one person might have noted a 4-finger separation, right? A 4-finger gap with their diastasis recti, and the other person has maybe a 2-finger gap, right? Or a 3-finger gap. Now, the person with the 4-finger gap, if they've been really active during their pregnancy, if they were, exercising, working on their core strength during their pregnancy, and generally, in a better condition versus a person who's had that smaller gap, who wasn't really exercising during pregnancy, really only focusing on just maybe some walking. The person with the 4-finger gap, right, is more likely to be able to do exercise or functional tasks like planks. Their strength is more likely to be better versus the person with a smaller gap, just because they've already started using those muscles and creating that tension. So it's just something really important to remember there. Go ahead to the next slide, Aisha. Okay, so we often hear this term, right? Mummy tummy. And essentially what it refers to is this classic postpartum mummy pooch, right? That happens. And it's a mix of this laxity, the weakness, the thinning. Again, not just in the linea alba, that middle section of your stomach, but around all the muscles and the connective tissue in the abdomen. So this picture actually refers to this woman standing. If we're talking about mummy tummy, it's referring to the woman who's standing, and we have a side profile, right? So it looks like she's still pregnant, but she's not, because she has all this laxity. And again, completely normal. It's a natural process that the body goes through. Now, when we talk about doming, that's this picture that we have of this stomach area, right? And it's like a mound, like a kind of like a hill or a mountain appearance that happens at your abdominals during any kind of exercise or any kind of increased abdominal pressure, right? And so the muscles aren't able to create the tension that they need to support this pressure system that they have, right? And so you get this doming look. Now, it's not only, again, like I said, about the exercise. It could be when you're trying to get up from bed and you need to, lift your head up and work those abdominal muscles, or getting up from a chair, or getting up from the floor when you're playing with your child. So we're using that pressure system all the time, even when we're going to the bathroom, right? And so you might notice this doming look that happens. Go ahead to the next slide. So what's the treatment, right? You can start even addressing diastasis recti immediately postpartum in a very gentle way. And again, clear everything with your gynecologist before you start doing anything. But in terms of what we do to help as physiotherapists, right? We help with breath retraining. So we spoke about how that diaphragm has now stretched out, right? Your rib cage has opened up more. And so we need to start teaching those muscles that are important in breathing, which are abdominal muscles, your diaphragm, your pelvic floor muscles, to start working and functioning the way that they were before the baby was inside, okay? A lot of women they don't feel supported because, like I said, those abdominal muscles aren't able to work and function the way we want to. So abdominal wraps or binding can really help women feel more supported in those 6 to 8 weeks postpartum while everything is healing. And what I would typically recommend for that is having a wrap or a binding that's not restrictive. This picture of this woman with a wrap is a good example, because you want your stomach to be able to move, right? You don't want it to be like a corset that's completely tight. We want to allow some level of movement and stretching, right? But also some level of support. And then scar management, whether it's around your perineum, so if you've had an episiotomy or a perineal tear, or your C-section, right? A lot of times when we have this scar, right, you get a restriction in that connective tissue, not just in the muscles, but the connective tissue, which is like a thin layer surrounding all your muscles, whether it's in your abdomen or your pelvic floor, or even in your legs. And so if you've got restriction there, your muscles can't move the way that they want to, right? So number one, it helps with pain management. If you are really uncomfortable, either down in your perineum or at your stomach area with a C-section, that massage, it's a very gentle massage around your scar tissue, helps to increase that blood flow and that healing, and also decrease the pain. But then it also starts to move that connective tissue so that your muscles are able to move and get stronger the way that we want them to. And then we also help with constipation management. So constipation is really common postpartum because of the changes in your hormones and the ability for the bowel to move through your large intestine. And so a lot of times what people do is they start to really bear down or push down to try to get that bowel movement out, but they're not able to manage that intra-abdominal pressure. And so that actually makes them feel worse, makes that if you're not pushing or creating that pressure in the right way, you're again putting more force down into your pelvic floor than you might need to, or you're not feeling as supported from your abdomen. You might be stretching it further out. Okay, so we really help with that. All right, go to the next slide. So now, let's say you've kind of moved on, maybe it's a year, 2 years out of after giving birth. A lot of women, don't go see the physio even 6 to 8 weeks after, because you've got so many things going on in life. You're a new mom, you've got a new baby to take care of, your focus is primarily on the baby. So regardless of any time when you start treating your diastasis recti, these are some of the things that we work